2 years ago, President Museveni elected to increase the salaries of health workers in a bid to see them operate under better working conditions. It was thought that with better pay, the doctors, especially specialists, would be more committed to their jobs. However, there have been several reports of absenteeism despite the increment in pay. In the most recent case, the permanent secretary of the Ministry of Health, Dr. Diana Atwine, threatened to have doctors who absentee themselves from work fired.
I need to know whether clinic officers in this hospital should remain or we should sack. All these clinic officers maybe should go because there is no single output. Sitting in OPD and just prescribe only OPD, that doesn't make someone a clinic officer and they are cheating government.
Dr. Atwine was touring health facilities in Chegegwa. Now, in a letter to the Minister of Public Service, the President has brought up the matter again, calling for the sector to take action against doctors who absentee themselves from work in government hospitals to concentrate on private practice. The President's concern was drawn by reports of an orthopedic consultant at Masaka Regional Referral Hospital, Dr. Godfrey Pariyo, who has been absent from duty but still drawing a salary. The President has proceeded to dismiss Dr. Pariyo in public interest. However, the Uganda Medical Association President, Dr. Herbert Luswata, has expressed concern over the move to summarily dismiss errant doctors without relying on established procedure. He notes that the decision should not only be restricted to health workers.
We request the President that this not only targets the health workers, and if it is really necessary, and if it should be done, let it be done for all the public servants so that it does not look like a witch hunt against us, the doctors.
Dr. Luswata acknowledged that Dr. Pariyo's absence from work amounted to unprofessional conduct. However, he also expressed concern that the move to dismiss all doctors in private practice who are also in government employment could cripple health service provision, as there are 400 specialists in the country against an ideal demand of 1,200. Almost all these specialists are shared between government and private health facilities.
But it is important that the government also puts measures in place to ensure that we get enough orthopedic surgeons. There are a number of things which can attract people to behave in the way they are behaving. Yes, the government is paying well the consultants, but if the private sector brings in more money, being that there are very few, it is also something which may be really very hard for government to say that they will stop.
According to the Masaka Regional Referral Hospital Principal Administrator, Mr. Charles Tumusime, Dr. Pariyo has not been at the facility for over 2 years.